Hello, my name is Bryce Hartman, and I did my project on increasing marijuana health literacy. So, health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make the appropriate health decisions. So, it's important because without a good health literacy, then these patients aren't going to be able to make the right decisions for their health and well being to be 100% good. Um, with health literacy, if they have a good understanding of it, then they are knowledgeable about their bodies and able to become better health. Health literacy is affected by a lot of different things, including race, gender, age, and mainly education level. People with a low education level have very, very low health literacy in all aspects. Um, it is shown that people of white races have the highest health literacy, older people have the lowest health literacy. And this becomes an issue with medical marijuana because we see a lot of older people coming in to use it. And if they don't know anything, then they're not going to be able to use it properly and get rid of their symptoms. Um, so, ways to assist increasing health literacy include doctors, by doctors sharing their knowledge to these patients, handout material, and personal research. So, marijuana health literacy, there's a lack of basic knowledge surrounding marijuana. And that's mainly because of the view that people have on it in mainstream media and what the government has done in the past. So when FDR was president, he made marijuana a Schedule 1 drug, and that turned a lot of people away from it. That's when it transitioned from being a medicine to being a drug. Um, they faked a lot of studies to make the American people think that marijuana is not a good drug, and they put it into Schedule 1, the same with heroin, so that researchers couldn't do any research on it. We weren't allowed to research any health benefits of it and nothing like that because they made it a Schedule 1 drug. So that created a lack of education sources. And there's a lack of education studies in the medical field. So these doctors and researchers aren't even able to get the information that they want. And there's also a lack of education within the dispensary field because there are no requirements for these dispensaries to give their workers courses or any education materials before they start working there, since it is still illegal federally. And there's been no one that has taken it into their hands and made it a priority to educate these people. So, what I've done is I made a brochure, a beginner's guide to medical marijuana, and on it I have included um, the plant, an overview of the plant. It gives you a basic aspect of female plants are the only ones that contain THC, the trichomes, and the leaves. So it tells you the useful parts of the plant and what they can be used for. I also gave an overview of routes of administration, so the ways that you can consume cannabis and use it as a medicine, so that these people have different ways to use it rather than just thinking that they just have to smoke it. Um, there's also dosing that I included, which is very difficult because with marijuana, it's more of a trial and error. It's not a one size fits all drug. You have to be literate, know about this stuff, so you know what is helping you with marijuana, which is where I can get to the terpenes. Because the terpenes are what is in marijuana that enhances the effect and creates that healing part in your body. Um, so, if people don't know about the terpenes, then they won't know what is in the marijuana that's actually helping them. I also included a helpful website so that people, after they read this, will be able to go back and further research this stuff and get more information. So I included that because it makes for an easy way for them to trust the sources and know what is on those pages. So if they're looking for dispensaries, or if they're looking for education, or if they're looking for laws or news, they'll have those sites to go to and know that they can trust them. And I also included my references so that they could go into those sources and look more into the information that I provided if necessary. So I created a handout material as a brochure because it's easy to read. You can include a lot of information and it's easy to distribute. So my target audience is prospect medical marijuana patients, current medical marijuana patients, and healthcare professionals, including doctors, nurses, and all the workers in the cannabis industry itself. These will be distributed in doctors' offices, dispensaries, and I'll also have an online version for people who, if they Google medical marijuana for beginners, it'll be one of the first things to pop up, and then they'll have those sources right there to look at also. So this will provide a solution. It won't 100% provide a solution, but it will start providing a solution. It's all part of a whole to provide a solution. So the brochure will give an overview of medical marijuana, and then if they use those additional resources to further their education, then it will create a greater health literacy for these patients and doctors and workers. So here are my references. So basically, this product of the brochure will be put into these doctors' offices and dispensaries and handed out so these patients will know different ways that they can use the drug and how they can better use the drug in order to make themselves better and healthier. So that's our overall goal.